Next question comes to us via emails from Jonathan in Salem, Oregon. He writes, "Hi, Dr. Ordon. I've been very insecure about the size of my penis my whole life. My wife says it doesn't bother her, but I really believe it will improve our sex life if I get a penis enlargement. Do you have any recommendations?" And do people ask us all the time, Dr.
I do have
O?
recommendations, and it's a normal thing for guys to, how do you measure up? But I would never encourage going through a penis enlargement. You know, what I would encourage is, hey, change the things that you can non-surgically. Make things look better in the neighborhood. What do I mean? Get yourself in better shape. Work on those abs. Do a little manscaping. In fact, the right kind of manscaping is going to make things look a little more inviting, possibly a little bit bigger. And you know, there's other penis enlargement techniques that have been tried. The pills, the exercises, the weights.
And
I can just imagine,
none of them work.
I can imagine attaching like a 5-pound weight. I don't think so.
Let the thing hang.
Actually, though, you could do some real damage with some of these quote-unquote options, right? Because if you, like, attach some weight thinking it's going to, make you bigger, I mean, it may swell you up like black and blue, but not going to be good.
And there are surgical options, so let's go through this quickly. I've seen them done. I've assisted in them. I've never done them as part of my practice. But the first procedure I want to talk about is where, let's imagine this is your scrotum and this is your penis. In some men, the attachment to the scrotal skin attaches down the length of the penis, okay? So let's say in this case...
So the underside of the penis doesn't look as...
Right, I'm going to do it this way. So once again, this is the penis, and this is the scrotum, and this skin is attached, which takes away the length of...
Holds it down.
Yes. So by trimming some of that skin, you see that it gives the illusion of more length, and in fact, this skin from the scrotum can tether it a little bit. It's a very simple thing to do, quick fix. The classical penis enlargement procedure, 3 steps. The first, and you can see this right here, is the ligament, penile ligament that attaches to the pubis down to the penis. By cutting that and releasing it, you will get a little more hang to your penis. Second thing you can do is, it's called a V to Y advancement. You make a cut on the penis right in here, and you do a plastic surgical maneuver where you push more skin forward. Doing that, you can gain at most a couple inches. But, if you're really small, then maybe that's an option. And then finally, you want to add girth, and how that's done either with fat injections or putting dermis in there. And that's where the problem is, that I've seen where fat has been injected into the penis, and the problem is where it takes is fine, but where it doesn't take is not good. So you get a very irregular looking kind of cauliflower-like penis.
You get a lumpy, bumpy penis.
If the wife is satisfied, then you're risking making things worse by going cutting and scraping and doing these whatever.
And guess what? There's so many other things that you can do sexually to satisfy your partner that hone up on those skills. And
it all begins with dressing up as a gladiator.
You may go to the head of the class.
Dr. Ordon, thank you.